Dealing with a serious medical condition can be stressful and sometimes overwhelming. Dr. Phil Stieg is an expert at making complex medicine easy to understand. He's one of America's most trusted doctors and chairman of the Department of Neurosurgery at New York Presbyterian Hospital, Weill Cornell Medical Center. Now here's Dr. Stieg with life-saving information you can rely on to make the most informed decisions about your health.
Hi, I'm Dr. Phil Stieg, here to tell you what you need to know about Parkinson's disease. Body movements are controlled by specific regions of the brain interacting like circuits in a computer. When one or more of these regions begin to function abnormally, the circuits send incorrect information to other brain regions, resulting in abnormal body movements. The most well-known movement disorder is called Parkinson's disease, caused by the death of specific cells that create a chemical known as dopamine. Why these cells die remains a mystery, but the result is an abnormal circuitry in the brain resulting in abnormal movements in the body. Typical symptoms include leg and arm tremors while at rest, stiffness, and freezing or difficulty in initiating a body motion. Early on, medications which replace the chemical dopamine are very effective in treating the movement disorders. However, with disease progression, the medications may become less effective, or the patient may also experience serious side effects. In more advanced stages of the disease, the medications may become less effective despite taking increasing dosages. In addition, due to the increased dose, a patient may develop uncontrolled movements known as dyskinesias. These come on sometimes 5 to 10 years after the diagnosis and result in severe limitation of the activities of daily living. But there is an exciting surgical technique known as deep brain stimulation, which is offering hope and new life to patients that thought they were out of options. Deep brain stimulation is a minimally invasive surgical technique using three-dimensional computer technology and high-tech monitoring of brain function to implant thin wires or electrodes deep within the brain's circuits. These thin wires are then connected to a pacemaker which is implanted under the skin into the chest wall. Each pacemaker can be programmed to meet an individual's needs. The pacemaker sends continuous electrical impulses to the deep regions of the brain, correcting the abnormal body movements. As a result of the continuous electrical stimulation of the deep brain circuits, patients will experience a reduction in their symptoms, such as reduced body movements. A secondary benefit will be a potential reduction in the medication needed, thereby reducing the risk for bad side effects. We performed the first gene therapy in the world for Parkinson's disease, and it has been reported on the front page of the New York Times. Our world-class team of scientists and physicians are continuing to create new therapies for the Parkinson's patient, offering them hope and a better quality of life. For more information or to make an appointment with our team of specialists, come to our website, cornellneurosurgery.org. I'm Dr. Phil Stieg, thanking you and wishing you good health.
Join Dr. Stieg for more medical minutes at cornellneurosurgery.org.